Welcome into this segment of For the Children, and we'd like to welcome Dr. Ramsey from Dothan Pediatric Clinic. It's always good to have you on. Welcome back.
Thanks for having me back.
All right, now this term, I've heard it before, and it just doesn't sound appealing. Scabies is the word today.
Right.
And I don't know what it is, but it doesn't sound good, friends.
Right. Well, scabies is something that we're actually seeing a little increased incidence of here in the Wiregrass. There's been a few outbreaks in some of the daycares here in town, and so it actually is an infestation of a tiny bug that you can't see with the human eye. And so what it does is it burrows up under the skin, and then it lays eggs, and then your body actually has an allergic reaction to the bug and the eggs, and so it makes you break out in a rash that can be very itchy. In young, especially very young infants, they can get bumps and rash kind of all over, head to toe. In older children, it tends to be more clustered around the hands and around the waistband, but it's something that is very aggravating because it is very itchy. It's also a little difficult to diagnose early because the signs can be very subtle and it can mimic other things, especially in really young children.
All right, so it's a kind of a weird predicament then. What do you do to fix it? If
the treatment actually is very simple. There's some prescription creams that you basically put on from head to toe and leave them on overnight and wash them off the next day. That kills the bug and the eggs. However, the rash can actually last for 2 to 3 weeks after you treat.
Wow.
Because that bug and those eggs have to be sloughed off in that layer of skin. So you replace your skin about every 21 days, so the rash can actually last after you treat it, which can be something that's very frustrating for families. It's very difficult to kind of catch just with casual contact, just shaking somebody's hand, but the reason why it kind of clusters in daycares and nursing homes is because they have more close contact, and so it's not very common to get it from an animal or anything like that. You usually catch it from a family member or somebody else that you're spending a lot of time with.
Gotcha. Okay. Is there, if you think you've got it, what do you do?
Right. There's a couple things. You want to go to the doctor to confirm the diagnosis and then the treatment. And then there are some things that you'll want to do at home, like wash your sheets in very warm water, wash your bedclothes, because sometimes people wear pajamas more than one day. So wash your bedclothes and any kind of brushes or ribbons or anything like that that's been in contact. Those need to be isolated for a while just to make sure that the bug isn't living on those.
Gotcha. Okay. And can it turn, real quickly before we go, can this turn into something more harmful?
Complications are very rare. The most common complication will be getting infected places from just scratching it. So usually just using a little topical antibiotic ointment. There is a more severe form of scabies called Norwegian scabies, which is usually seen in people who are immune suppressed. So that's very uncommon. That would be something definitely to talk to your doctor about. Most kids are just itchy and inconvenienced.
Gotcha. Don't Google this. Just call your doctor. Anytime I Google something, I feel like
it sounds a lot scarier than it is.
I feel like the end is near for me. Anyways, yeah, we can help you out as well. Don't Google it. Just email us, morning@WTVY.com, and we'll get some expert analysis from Dr. Ramsey. If you'd like to watch this again, head over to the website, WTVY.com.